Trudy Mason sitting in for Aaron this week, welcoming Liberal MNA Andre Fortin. He's also the official opposition healthcare critic. Andre, thanks for joining us on CJD.
Good afternoon.
I have some questions for you about recent events and recent information that's come out about healthcare. I want to bring up Santa Cabrini and that OQLF visit off the top. You know, Antoine Robitaille, in his column today in the Journal de Montréal, accuses Anglophones of inventing linguistic fears in how they felt about the Santa Cabrini Hospital visit by OQLF counselors, advisors. Do you think the Anglophone population is making up fears?
Well, here's the thing. You can't tell people how they feel about things. And there are people in the English-speaking community who are worried about this. And they're worried because the directive that these OQLF inspectors are being asked to enforce is the new directive coming out of Bill 96 is wildly unclear. First of all, people were told very clearly by the government, by the premier, by the health minister, by the French language minister, by Christopher Skeet, that there would be no impact on the availability of healthcare. Now, that's one thing, but the new directive that they put out related to Bill 96 lists a whole bunch of examples that give place to a ton of interpretation and that will be, because it's so vague, interpreted all sorts of ways by healthcare workers. And obviously that is going to put patients in a position to be worried about, am I eligible? Will I be able to get access to healthcare in my language and to fully understand everything I need to understand? And it's going to put healthcare professionals in a place where they're constantly wondering, am I doing something wrong here? Can I give this person services in English or in Italian or in other languages? And honestly, our healthcare workers have enough on their shoulders as it is.
What do you make of the office going back and forth, at first saying, oh, no, we sent no inspector to Santa Cabrini, and then saying, oh, well, we did send an advisor or a counselor who's supposed to accompany the hospital on its francization journey?
We can play on words all day. The fact is that everybody in Quebec, whether it's government, whether it's healthcare, whether it's private businesses, everybody's subject to one aspect or another of the Charter of French language, and there will be inspectors that are sent out. The issue is, what are these inspectors or what are these advisors saying? And if they're simply telling the hospital staff to enforce this directive, well, it's just not clear. And I'll give you a very simple example. This directive is 31 pages long. If the government's line is to say nothing changes, access is the same, you will be able to access services in your language, you don't need 31 pages to explain that. If it's clear, it's going to be clear. And if you go through the directive, it says something like, an Anglophone father comes to the hospital with his 10-year-old son. The hospital staff may ask the father in English for consent. But does that also mean that they can tell him about the follow-up medication he has to take, the follow-up appointments he needs, the care he's getting, and all that? It's just so precise or so imprecise that it leads to all sorts of interpretations, and it will be, unfortunately, it will have an impact on patients unless it is clarified. So that's why we're asking government, the healthcare minister, the premier, to end this debate and just say, no, nothing changes here. Everything is the same, and everybody can get services in the language that they understand.
Andre Fortin, would a Liberal government roll back those provisions?
Well, I can't speak for the next Liberal leader because I still don't know who that is at this point. But we voted against Bill 96 because we think it goes too far, and it goes too far on some of the stuff that is included in that healthcare directive. What we believe is that everyone who requires healthcare in English should get it, and also that there needs to be clarification on whether Santa Cabrini still has bilingual status, whether the Chinese hospital still has bilingual status, whether the Portuguese long-term care facility still has bilingual status, because as Aaron Durfel was pointing out a few days ago, there is a little bit of uncertainty around these specific establishments. But to us, there should not be any change in their legislative mandate.
So much to talk about in terms of healthcare. We've had more reporting out of Aaron Durfel of the Gazette, that article showing that 780 doctors in Quebec have opted out of Medicare compared to, is it true, just 14 in all the rest of Canada. The Liberal Party's musings on that phenomenon.
Yeah, the private healthcare network in Quebec for years has been accepted to be complementary to the public healthcare network, which has to be your main healthcare network and the main way to access healthcare in the province. But at this point, I'll give you the example of my own region in the Outaouais in West Quebec. More than 50% of the surgeries will be done in the private sector, whether that's still state sponsored and paid for or fully private surgeries. It's no longer a complementary network. It's become, it's taking more and more places. And when you see family doctors, people being forced to pay to simply access family doctors, and we're not talking now about the ones that they get through their own insurance or whatnot. There are people who are choosing to pay to have access to family doctor, and that really should be a universal right in the province and a free access to it. So it's taking more and more space in terms of healthcare, and we don't see anything from government saying that they are worried about this, that they want to slow it down, that they want to make sure that the public healthcare sector takes more and more of the space that it should take, and that's why we're worried about the next few years.
Do you have any solutions?
Yeah, well, absolutely. I mean, and whether it's in terms of having doctors in the public sector, or whether it's in terms of reducing wait times, there has to be an emphasis put on recruitment and retention of our healthcare personnel. There are a lot of specialist doctors right now who are leaving the public hospitals because they simply cannot get surgical times. And they can't get surgical times not because they don't have patients, not because they don't have emergency rooms or operating rooms, not because there's no need for their services. It's because they don't have nurses to assist them, because they don't have the personnel. And that's why a lot of Quebecers aren't getting surgeries right now. And that's why doctors are leaving the public healthcare system. So that is one thing that absolutely has to be addressed. And we would like to see, we've been asking this from government for years now, a full-fledged strategy on retention and recruitment. There seems to be little efforts here and there. We're going to go recruit abroad in this particular country for this particular province, but there's no overall strategy, and there doesn't seem to be a complete vision from government on this.
Andre Fortin, Liberal M&A and opposition healthcare critic, I thank you very much for the interview.
All right, my pleasure. Have a good day.